Hi, Dr. Sophia here. Welcome to the Move Your Way Out of Back Pain series. So today we're going to open up the hips to unlock your low back, okay? So I've seen people do the figure four stretch and do passive stretching, and that's not going to create a change for your body. You need to involve the brain with your movement, especially while you're stretching. You need to include some type of muscle contraction to reprogram the brain to create a change in your body. So when you do passive stretching, that's at the spinal cord level, and your body's not going to change, okay? So to open up your hips, unlock the stiffness in your low back area, we're gonna go through a movement of three different positions, okay? So the first one, it's an active figure four stretch, okay? The second one is the single leg kneeling hip flexor stretch. And we're gonna integrate everything dynamically with the dynamic hip mobility, hip, spine, shoulder mobility, okay? So let's get started. Let's unlock those hips, open them up to free your back, and you're gonna feel so much better after. Okay, so join me right now. We're gonna lie on your back, okay? And this is going to be challenging, I'm not gonna lie. This first one is challenging, but remember, we wanna create a change. Let's set the intention, give the movement purpose to open up the hips, okay? To unlock the stiffness in the back, to reduce pain. Set your intention and give your movement purpose, and it would do that for you, okay? So what we're gonna do is the active figure four stretch first. I have my left ankle over my knee, okay? And we're gonna be in this position. If you need to prop up your head, you don't wanna be here, okay? You want your spine in a good position. Prop your head up with a little rolled up towel. So that's more firm than a pillow, so that way you're here, okay? So I'm gonna loop my hands and both my feet are flexed. You shouldn't be able to see your foot here, okay? Bend it to where it's like at a 90-degree angle. I'm gonna loop through. So what I'm gonna do, I'm not just hanging out here and feeling a stretch. I'm gonna actively create a rotation of the hip. So we're gonna use the butt muscles, okay, to bring this, you're gonna move your knee away from you. And you're gonna do this for a full minute, okay? Full minute. All right, so what we're gonna do is that right now see how it's here? I'm gonna actively open up the hips. Make sure that the weight on your low back is even. When you are tight, you're gonna be leaning over to more than one side than the other, okay? Make sure it's even, so shift your weight. Eye contact is looking down the whole time. So this is max tension to create that change. All right, so here we go. I'm gonna count to 30 seconds in my head, but you can do 2 rounds of 30 seconds or 1 minute once, okay? So here we go. So I'm bringing the rib cage down and in, looking down, breathing, exhaling it out. At the same time, I am moving my knee away from me. I lost count. That was pretty much close to a minute. So I'm gonna show everything on one side, but at home you're gonna do both sides always, okay? Woo! So after you do that active figure four on both sides, you're gonna get on your knee. If you need to prop your knee on a pillow, go ahead and do so. Remember, you want your knee right on top of your ankle joint. Both hands over the knee, and your back foot can be flexed or resting just like that. Okay, so remember, it's not here, all right? We need to tuck the pelvis to lengthen the group of hip flexors right here, okay? So you can adjust or like play with the pelvis a little bit so that you can feel what you need to do. So if you're here, just go ahead and do that. Use your breath. Exhale, tuck. Just kind of loosen that up. So now what we're going to do, we're going to squeeze that butt muscle, all right, for a full minute. 1 minute. Okay, so I'm going to breathe in. I'm going to breathe out and squeeze my butt more, tucking the pelvis more. And I'm going to grow tall when I exhale. Oftentimes when we breathe out, we lose our posture. We want to maintain that upright posture and grow tall every time you exhale. You can use your hands to cue. Keep squeezing. And you should feel a nice stretch here in the front. We're actively creating a change, getting the brain involved. Okay, so you're gonna do that for a full minute. Then you're gonna get on hands and knees position. So I'm doing everything on the left leg, but at home you're gonna do everything on both sides. So now I'm gonna come out. My leg is down this way. I can also flex the foot as you can see here, just like that, but I'm gonna bring it down. All right, so you want your wrist right below your shoulder joint, okay? And you want to push yourself away from the floor, okay? Lengthen through the spine. You don't wanna be here, okay? Or arching whatsoever. Push, turn this on, always to help support the spine, okay? I'm gonna breathe in now. I'm gonna exhale, push down towards the ground, keep my chest open and the shoulders down and away from my ears. And you're gonna inhale, exhale. And you're gonna feel a nice stretch pulling here in the inner thigh groin area, okay? So you wanna do 15 of these, nice and easy. And then when you're at the bottom, what tends to happen, we lose the bracing, the abdominal contraction at the bottom. So to cue yourself to make sure it's on, you can cough. Just to make sure. So I can go and hold it. Remember, breathing is important with movement, okay? So you want to breathe through the whole time. Do not hold your breath, okay? Your diaphragm is one of 5 structures of your core, so you really want to integrate it when you're moving. Okay, so there you go. Opening up the hips to unlock the back, okay? So go ahead and give that a try and let me know how it goes for you. Okay, here we go. See you soon.